Welcome to DRX Podcast new episode. In this podcast, we invite people from the field of pharmacy, and today we have a very special guest with us. She is Pharm.D. She is BCPS Board Certified Pharmacotherapy Specialist.
So without getting any delay, so let's welcome Dr. Anita Ann Sunny, Pharm.D, BCPS. And today in this podcast, you will get all your answers.
So let's start this.
So, ma'am, as you are saying that doctors are so busy, and yesterday I'm just looking at some articles. So, WHO posted a new article on that doctor-patient ratio. It's 1:1,000 ratio. We are also talking about patient care.
Yeah.
And whenever the patient care term comes, the PharmD raise your hands that we are here for the patient care. And whenever, as you told that patient counseling is very important, communication with the patient is very important. So, but there are some barriers like whenever
we talk to doctor, we hesitate.
So I'll just take the question once again. It's like you are having some hesitation in talking to the physician and conveying that particular part to the patient. So a small barrier in patient counseling also. It's like not every time we'll be able to apply the theory into the practice. So when a patient comes with some symptoms, some fever and some infection, the doctors, they'll have multiple thought process going on. We might be suspecting, or the doctors might be suspecting a viral fever, but they'll also have their own doubts on regarding a bacterial infection also. So if you look into the comorbidities of a patient, if they are really immunocompromised, like someone with an uncontrolled diabetes will have a very compromised immune system. So there you'll have to suspect a bacterial infection also. Not all patients will come with a clear diagnosis written on their forehead. So it's going to be a tough situation. But when we counsel the patient, we can tell them something like there are two methods actually. Either we can ask the patient what are the symptoms and get to know about the patient, what they feel about the doctors treating them, and how they feel about you people talking to them. Uh, Create some rapport with the patient first. One method. Second thing is like you can ask the doctor directly, sir, what would you like us to convey to the patient? And how can we counsel them? Getting some points from the physician is also really nice because you'll get to know what their thought process is and you can add those points along with your counseling points. So utilizing these two methods, start talking to the patient in a general way. Like you're having some symptoms and we are treating it as a viral infection, but we are not in a position to exclude the bacterial infection also. So we are trying to give you medicine so that we'll take care of you as a whole, and we would like you to get cured from these symptoms as soon as possible. So this would be the best treatment regimen for you. So giving them some assurance from the treatment what we are giving, it's going to help the patient a lot. So make sure that you're not having any doubt. So just prepare yourself. If the patient feels like, okay, the person who is talking to me is also not confident, so they are just doing some medication trial on me and seeing whether my symptoms are subsiding. So this all will take some time. You need to practice yourself. So just be confident, just give it a try. Slowly you'll make it.
My next question is, what are the improvements you would like to suggest in PharmD?
Especially we need to be more clinical, and so more clinical people involving in teaching and training the PharmD would be a great change. And yeah, of course we need some good change in our syllabus too. Most of the topics or most of the subjects we learn are pharmaceutical thing. For example, pharmaceutical microbiology, pharmaceutical approach of yeah, pharmacognosy is required, but I'm happy that they are not complicating pharmacognosy like what they learn in B pharmacy. At least they gave some kind of freedom to us. But we cannot exclude pharmacognosy totally because we do have medical preparations coming from the herbal plants. So I would like to focus more on the microbiology side, where we are learning more of pharmaceutical microbiology, and if it can be turned like a clinical microbiology and pharmacology too. We need some clinical pharmacology approach to it. Most of the time, we learn the theory part of pharmacology, and thanks to pharmacotherapy subject, we are having some kind of application. But if we can make it more of clinical pharmacology, it will have a different aspect, and it will make it learning more easy and more interesting. So some these kind of changes and I would like to include clinical examination in our syllabus too,
Yeah.
because in like what I saw in US, they're taking care of the patient totally. So if you want to know whether this particular symptom is an adverse event of this particular medication, you need to know some clinical examination that is very much required. So at least if that can be taught in the internship time, and when this human anatomy and physiology, looking more into the human body, taking care of the, so starting the clinical examination much early, maybe in first year or even second year should be good. Some practical sessions for clinical examination, and making us do the clinical examination during our internship with some guidance.
Yes.
If you are posted with a physician, at least someone from the pharmacy side who can come and guide us for the clinical examination, keeping some clinical examination classes frequently by the doctors. These things would really give some good change for the upcoming PharmDs. Something which I feel like it was lacking in our syllabus, and it would have been really nice if we had known this previously.
Sure, ma'am. Okay, ma'am. So moving forward to next question. What motivates you to do BCPS, and can you explain us about the eligibility criteria and all?
Yeah, the need for BCPS. Maybe I can tell two reasons. The first one is, as you mentioned, the pharmacotherapy. So
Yeah.
during my fifth year, uh, like when I was doing some research after PharmD what to do, I got to see this residency programs in USA. And among all the specialties, pharmacotherapy was really interesting because I saw that it was the toughest one because it included all the departments, all specialties, and it's like something like an MD in general medicine. So it was really interesting. So I wanted to do that residency. That was a dream for me. And after going for the 2 month internship in USA, again, that thing was like boiling inside me. But some financial issues, some practical difficulties, and it always was there inside me as a dream. So during my practice, I just tried bringing all the US standards in my clinical pharmacy service. And after 3 years of experience, when one of my colleague told me like, even without doing a residency, we can attempt this BCPS exam. That was again kind of okay, fine, let's take it as a challenge. So for the next 3 years, I continued learning this pharmacotherapy, the syllabus, and all the diseases from each and every specialty. And practicing in neurology and learning all this stuff was really tough because especially the oncology, pulmonology, all those diseases were not something which I was dealing with on a daily basis. So, learning the guidelines, going through all the medication, it was kind of tough for me. So, okay, only thing was like instead of doing a pharmacotherapy residency, since I considered the clinical practice as an equivalent thing, so I had to take up this opportunity. So after two failures, I failed my first two attempts and I passed on my third attempt. So all those the 3 years time was really hard, but what made me keep on learning was my passion to learn.
Yeah.
And the second reason which I wanted to tell is the daily challenges. Daily whenever you see a patient, you'll get to know that okay, I don't know what this is, I don't know what this medication is, I don't know what to treat, how to treat this patient. So that challenge which I felt when I saw each and every case made me feel like okay, you have to learn a lot, there is a lot to learn, keep updating yourself. Even though I was practicing in neurology, it's not pure neurological cases we deal with, but all the diabetes, hypertension, all the cardiac diseases, rheumatological aspects, neurological complications in oncology patients. It was a mix in neurology. So I felt like, okay, they don't have any neurology specialty for this examination. So why not pharmacotherapy? So for these two reasons, my pharmacotherapy residency dream and the daily challenges in my practice, these two motivated me a lot to take up this BCPS exam. So when I failed twice, one thing I one thing I told myself was, "You have not learned enough. You have not passed your exam. you have not learned enough. There is a lot to learn and lot to bring in your practice. So that motivation I had to keep telling myself, motivate myself, and that learning that gave me a lot of happiness. And whenever I learned a new point, something, even a small point, gave me a lot of happiness because it gave me a good new perspective to the patient care. So applying everything to my clinical practice, it was a really good experience, and I wish all those who are preparing for this exam get the same thing. And regarding the eligibility criteria, depending on the specialty which you choose, the eligibility varies. For pharmacotherapy, it was 3 years. And when you take something like critical care or infectious disease or oncology, you'll require 4 years of clinical practice. So for each specialty, they have specific eligibility criteria. And luckily, they are considering our
Course.
clinical practice.
Yeah.
Even if it is course is one thing, and the people who are practicing outside US, it's a big thing that they are giving us this opportunity for sitting and appearing for this exam. And the pass rate is, I can't tell it's very low, but it's like 60%, and it's one of the toughest exam a clinical pharmacist can sit for. So, regarding the eligibility part for this exam, there are multiple specialties, and the one which I took is pharmacotherapy, and for that, 3 years of clinical experience is required. For other super specialties like critical care, oncology, infectious disease, they prefer 4 years of clinical experience. So, depending on each and every specialty, the clinical experience number of years will vary, and each year they are trying to update and make some changes to improve the quality of the certification. So minimum 3 to 4 years is required after you receive your license.
Okay.
That's the main thing you need to focus on. So even if you start practicing in Jan, but if you're getting your license approved from the pharmacy council by May, then from that May only your experience will be calculated.
Yeah.
So that's the main eligibility criteria. And then in your practice, whether you are uh, like in your practice, if you are doing more than 50 percentage of the examination content, so they have some this many percentage from pharmacotherapy, this many percentage from the evidence based and clinical research uh, area. So that specifications, if you are making it like during a practice, if you can allot this much time for these domains of the exam, that's what they are expecting. So it's just part of filling the examination criteria, but mainly you have to look into your clinical experience years. That's all.
Is there any
Prepare.
book for BCPS to prepare BCPS?
Yeah, there are so many preparatory courses for this which you have to purchase separately. I won't tell that you have to purchase it right now, because over this 3 years of time, it will be for like 6 months and 1 year duration, and it will be expired after 1 year, and it's really expensive. So during your clinical practice, just go through the syllabus and the content outline and see what they are expecting from you. And I did a lot of research uh, regarding how this exam is going to be and how the people felt after they wrote this exam. So going through those aspects will help you a lot to understand the mode of this examination. And so many free MCQs are available in the official BPS site, as well as some other people are also giving some model questions. So you can just get the feel of how you're going to ask these questions. And to make it simple, I can tell it's like standing in front of a patient. If tomorrow if you're seeing a patient, a diabetes case with some renal condition, he's already on this medication, sugar is not controlled. So what will be your next option? So of course you need the guidance from the guideline. And if they are suggesting like a gliptin, a DPP4 inhibitor, so which gliptin will you choose for that patient? So you have to consider the renal part, the age, the side effects, whether any gluten was tried or not, or is he really a candidate for insulin? So it's the same thing, but when it comes to an examination, you need to prepare well. You have to be updated with all the guidelines, whatever is available at that point of time. So when you are practicing, when you're gaining this clinical experience, make sure for each and every disease you are just going through the guidelines also. So when you start preparing for this exam specifically, when you get this review material, they will take you through the exam content and how you have to approach this exam. So many changes are happening on a yearly basis. So just going through whatever you have learned till now, I will tell like you can keep your Dipro as a reference. That should be more than enough.
We
plus
use.
the updated guidelines.
So my next question is, what inspired you to become clinical pharmacist? Because in fifth year we go for project work. We introduce to a new subject which is research, and most of the people choose research as a interesting field. So why you choose clinical for pharmacist or clinical pathway, and some tips you can give us.
Despite of having low salary.
In spite of having low salary, because most of the folks ask me that what is the salary of a clinical pharmacist. Every time I have a I upload a video, that the comment will come, what is the salary of a clinical pharmacist, what is the starting salary. So that's why I'm asking this question.
So starting from fifth year, I was thinking like what to do after Pharm.D. And during my internship also, like I had a clarity in one thing. I wanted to work with patients. So whether I go into a clinical research or whether I become a clinical pharmacist, I need to be with the patient. So even if not a clinical pharmacist, in the research path, I should be entering into a clinical trial site. Then only I can be with the patients. But I had no idea about how this clinical trial is going to be or what my role will be. So many question marks were there. But in clinical pharmacy side, I was seeing some of our seniors working as a clinical pharmacist. And in addition to that, after this 2 month observership, I had my own ideas on what to do and how to do. So by the time I completed my internship, I was like, okay, fine. Better you be in the clinical pharmacy field because if I'm not working with the patient, I may not be that happy. That was one thing. And a second point was like, whatever you learned in your Pharm.D, you can directly apply it in your patient. So
Yeah.
nothing is going to be a waste. Let it be kinetics or dynamics or college or therapy, whatever you learned, everything has an application in clinical pharmacy job. So that also inspired me. Okay, there is more to learn, and whatever you learn can be applied. You can keep on updating yourself. And salary was not a concern at that point of time because at the initial phase, it's always better that you get into a job and learn what is happening. And in case if you are not satisfied with the job or the salary, whatever reason you are focusing on, there is an option for you to switch your career either from clinical pharmacy to the industrial side or whichever way you want, the clinical research, or there are other options too. So this patient interaction was one of the main thing I wanted to do, and the pharmacotherapy, my favorite subject, and I was not sure how much I will be able to apply that or utilize it in the clinical research or the industrial side. So these were some factors, and one another point I would like to mention is after seeing the US practice and the patient approach towards a clinical pharmacy, I understood one thing like our patients or our population, the health literacy is very low. They are not even asking why this medication is being prescribed. They don't even want to know. It's a blind belief, and even if something happens, it's easy for them to blame. But if they knew something about what they are taking, what chemical they are taking, and what all things can be expected, the effect as well as the side effect. So they are not even bothered even a little about their medication. So I just wanted to change that thing. I wanted the patients to know what they're taking. I wanted to I wanted the patients to just ask. It's not like questioning the doctor, but just let them ask what I'm doing with this medication. Is it something that I should take lifelong? If so, why we are expecting them to take it lifelong? What are we trying to prevent? Is it a curative medicine? Is it a preventive medication? So what we are trying to bring in as a change for that patient. So that health literacy part, that is one of my motto as a clinical pharmacist to improve the health literacy of our population. And I am trying to bring it up by simple communication, counseling, telling them about their disease, this counseling about their medication. It's a very simple thing you can do, but the outcome will be like an improvement in the health literacy for our population. So, when you ask about clinical pharmacy, I would like to reframe that question like why I wanted to become a clinical pharmacist in India instead of going abroad. So, this health literacy plays a major role in my decision making.
And you have the chance to go to abroad, but still you choose India. This is a big thing.
Yeah. That was another major question I faced. Even now, I'm getting so many questions why I'm not going abroad with this BCPS. So I didn't do or take up the certification for going abroad, but I wanted to improve my knowledge so that I can improve my quality of care improvise my patient care and give a better quality of life for our patient. Indirectly, I'll be increasing the health literacy for my people, for our population. So that's why I'm staying in India. And whatever I saw in US, I wish I could bring that in India, or at least one person doing something. And if my juniors are seeing that, and if they are also trying to incorporate into their practice, that one person making a small change is more than sufficient. So slowly it will spread, and I'm expecting all of you to take it up. So it's not a big change or big thing I'm asking you to do. Just communication, just telling them what is happening. That's more than sufficient.
Monday will
Just sharing your knowledge. That's all.
Ma'am, my last question is professional growth in clinical pharmacy. What do you think?
Yeah, one of the major drawback for people to come into clinical pharmacy sector is what is the growth in this profession. So if you go to an MNC company or clinical research, so you'll have some designation which will keep on changing with some extra activities or some extra certification or extra learning. They will promote you along with some increment. In clinical pharmacy, from starting till the end, I think it will go on like a clinical pharmacist. Maybe you will be called as a junior and a senior clinical pharmacist. So if there is some change in that, it will be some motivation for the upcoming clinical pharmacist. So I have seen something like even if you are not taking up any extra certification, once you're practicing in a particular specialty for a minimum of 3 or 4 years, then as per the definition, you can be called as a clinical specialist.
Hmm.
So it's because that you have been specializing in one area. So if you can just Google what is a clinical specialist, that's what they try to bring it out. So a clinical pharmacist working in a specialty for a particular number of years, and they can be promoted as a clinical specialist. So or maybe you can call them as a cardiology clinical specialist or a neurology clinical specialist. Some kind of change in the designation will be a motivation
Hmm.
that plays a good role. And in my case, it depends on the hospital also, so they should be welcoming these changes. First of all, here what happened, I have been practicing as a clinical pharmacist for 6 years, and this change of designation was always there in my mind. And so unless we open up, we ask for it, many of the time the people may not be knowing, okay, this is something we can do for this particular group of people. So after I got the certification, I went and I discussed regarding this certification and what all changes can be done with the certification, and I requested whether this particular a small change in designation, if that is possible. So for the first time here, as well as for the clinical pharmacist, at least officially we could make a change from one designation to another, from clinical pharmacist to pharmacotherapy specialist. So that is giving me some inspiration, some motivation to continue this profession again. And I am also trying to improve my quality of care. Just change in designation is not going to help. So we should provide something helpful for the people whom we are treating and the people who are giving us this opportunity. So this change in designation, along with some improvement in the care and quality, so encourage the clinical pharmacists to take up more learning, either through some courses or some specialization or some certification examination, whichever is available and possible for them. Like many universities have started bringing in residency programs in India. So after completing those residencies, if they can be called as some specialist clinical pharmacist, they can focus in that particular area, and the recognition for the clinical pharmacist will also improve. So we all of us prefer, like initially the MBBS doctors were having good respect, and now and after that there was a small change in trend towards MD physician, and now even for a diabetes they don't prefer a physician, they want to see a diabetologist.
Hmm.
Yeah.
Specialization always has its own value. Many of them are asking, why don't I take up this pharmacotherapy so that I'll be the king of all specialty? It doesn't work that way. Even if you're the king, you will be missing a lot. When you
Yeah.
Yeah.
specialize on one thing, your knowledge will improve, and at least you can give better care in that particular area. So our people need to be instilled with these ideas, and some guidance has to be provided regarding this. So I hope our discussion will put some light for these people. Let's
Absolutely.
hope.
So before ending the video, I want to ask that what one message you would like to give to all the students who are doing PharmD?
Yeah, Pharm.D, it's not just a 6 year course, not just an integrated PG course, not a course for you to get a DR in front of your name, but make sure that you highlight yourself. You have to express yourself when you come out after this Pharm.D course. So there are some minimum expectations from your side when you come out. We are not expecting you to know everything. We are not expecting you to be a walking dipro pharmacotherapy book with all the knowledge inside your brain, but some basic knowledge is required. That's why I told you at least know the pharmacological classification mechanism and some side effects. So know when to give the medicine and when not to give the medicine. So it's easy to start a medication without any second thought. But when you try stopping a medicine, it's going to be very difficult because you need to know why it was started on the first basis and then why you're trying to stop it. Uh, Before starting it, you won't be having any fear. But when you try stopping it, you'll be worried like, will this cause some side effect for the patient? Not even thinking about the side effect of the medication, but what will happen if this medication is stopped. So keep learning, and this is a medical profession and you need to update yourself. So learning is going to be an on-ending process, and it should not stop once you graduate from your college. It's not something you can stop. Whether you're going to a clinical pharmacy profession, clinical research, or an MNC company, make sure you keep updating yourself and just enjoy whatever you do.
It's very important that you enjoy your profession, you enjoy your life.
Yeah, like when you take up a profession, salary is not just one factor you have to look into, but you need to make sure that you have a good working environment. Good salary is also a must. Good working environment, and whatever you do, liking your profession is very important. And as a clinical pharmacist, I am really thankful to my doctor. He is Dr. Rajesh Shankar Iyer. He's a neurologist come epileptologist, and he gave me so much support, and he taught me a lot. He trained me a lot. He never hesitated discussing anything, or like he always discussed each and every aspect of the patient, and he never considered me as a non-mbbs a person. And all the discussions, even though most of the things were like very tough for me, when he repeatedly mentioned those points, I started understanding what is happening. And each and every time when we see a patient, he was like discussing all the medical, non-medical, pharmacy, all the aspects were discussed, and he always made sure that our input, our interpretation for all those patients were also taken into consideration. So those kind of support is not something which you see every time. So I'm really thankful to my doctor for supporting me and helping me learn this much. And he helped me learn for the BCPS exam also by giving me some time to discuss the aspects which I was finding it difficult. And he trained me a lot in epilepsy also. So now I am confident in dealing with epilepsy cases. He taught me a lot of neurology, which is not something you expect from a neurologist.
Yeah.
Considering it as the toughest, one of the toughest specialty, learning everything about the brain, the functions, and how the patient is going to overcome the challenges after a stroke or whatever neurological illness they face. All those things came from patient interaction, from my doctor's teaching. So I really thank him for giving me the support throughout this journey. And still it's continuing. He's teaching, I'm learning. So it's very important that you get a good team. And even if you're not getting a good team, just try to making it, converting it into a good team. So you can do that. It all depends on how you create, how good you are in communicating with the people. So healthcare profession communication and patient communication is also important, equally important. So that's the one thing, maybe as a profession, when you step out of your college, these things need to be kept in mind.
Yes, ma'am. Thank you, ma'am. And also take us as a student and always teach us. And whenever we have a problem, we always connect with you and give us some time to solve our queries.
From next year,
Yeah,
we
sure.
launch in market.
Ma'am, from next year, we also come.
Yeah. Please, that's what. Whatever I told are just basic steps, and once you're into the profession, you will know what to do at that time. So it's not like you will be entering the profession with all the knowledge inside you, but each day you'll be learning something, and you should always have an open mind to learn new things. Don't feel like I have completed my learning and now it's time for me to practice. So keep your attitude down and just be open enough to learn new things. So that will help you grow, and that's the only way to grow. Keep learning.
Thank you so much, ma'am, for having your time.
Thank you so much, ma'am.
Yeah, Pragya and Nilesh, so thank you so much for considering me into your program. It was a wonderful opportunity. I hope many people will benefit out of this discussion. And yeah, we'll meet again soon.
Motivating for everyone.
Yes, ma'am.
You people are kind of a motivation for us to sharing our knowledge, giving us a platform to share our experience. It's also kind of motivation for us. So thank you so much.
So much, ma'am.
Thank you so much, ma'am.
Dip, 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 dip.